My name is Dr. Jemimah Kariuki. I used to say I'm a girl, but I'm a lady. I am also a wife, a mother, and a medical doctor in the field of obstetrics and gynecology. And I'm also the founder and the CEO of Wills for Life. I got pregnant in June 2020, and that was when I think it was the thick of COVID-19. We were still trying to understand the disease. We were still trying to understand the repercussions on pregnant women, on lactating women. And getting pregnant myself was a shock because for one reason or another, I was on the pill and it didn't work. The first impact for me was it was a shock. Two, I had started helping pregnant mothers to get to hospital around April. And at the time, I was doing it majorly alone. And that meant I was handling large volumes of calls, very large volumes of calls. So Wills for Life started because I realized walking on the corridors of the hospital that we were seeing very many complications that would be coming early in the morning because women could not get to hospital in time. And we were seeing so many preventable deaths attributable to bleeding. And we were seeing a rise in issues with, for example, hypertension. And there was literally no way to get to these women. Most of them would tell you that they had tried to call neighbors and they were scared of the curfew, or they just decided to wait it out in the house, and then they labored by themselves, and then now they were coming with a sickly baby, they've torn everywhere and such. So it was in the background of that I realized it was quite a big problem. And going online to see what was happening in other counties, I realized that it was happening in different areas of the country. And when now I read someone had died at home having given birth, but the baby was there, it crushed me. It crushed me because in any labor, there's a lot of screaming, there's a lot of pain, there's so much. So for this woman to have died alone in a village, it didn't make sense. And so I decided we needed a solution. And I remember going to my colleagues and asking them, what do we do? And the answer was the government should. And then I tuned in to listen to the then county health director, who was talking about how they'd given PPEs and how they'd given, they had employed more doctors, etc. And I realized the mind was so far from other issues that COVID was bringing that was not necessarily COVID, and that there are a lot of indirect effects of this particular pandemic. And in my headspace, it would take a lot of time before the bureaucracies of any government to facilitate this kind of help. I felt like it would just take long. And in the interim, something had to be done. And therefore, in my headspace, I had a curfew pass. And I started thinking, maybe I can go for them. Maybe I can equip them with information. And so I remember going to Twitter. I'm not a Twitter person usually, or I wasn't by then. But I had gotten tired of people clapping for me because as a healthcare worker, we were serving the community and we were working and we were risking our lives for COVID. And I felt like I wasn't doing anything, like I really wasn't. The department I was in at the time did not demand so much of my time. So I was actually doing audits. I was doing mortality audits, and every time I would see a death, that was so preventable. It arced me further. So here we have people clapping for us, and then I am seeing deaths and they weren't marrying. So I gave out my contact on Twitter so that people can reach out. And I vowed to help. I didn't have a master plan at the time. I just knew I needed to help. And I went back and told God, use me. I didn't also know how, but use me. When I started getting calls for it's 2 a.m. and I'm stranded, then I realized, okay, I need to do more. And I reached out to the few cab guys I knew who had also called because they wanted to help as well. And I reached out, where are you? I'm in Mombasa Road. Okay, I need you to go to Wayaki Way, somewhere there. Please get some lady, take them to hospital. And then another one called me, and then another one called me. So I had 3 patients, and I couldn't drive and go, like we couldn't split ourselves. So I realized I needed a bigger network than myself to kind of help women, which led me to start talking to my supervisors, my lecturers, and try sort help. And they were very excited about the whole idea. I wrote a concept note. It was my first time writing a concept note. And then I got introduced to Dr. Wala from AMREF, who introduced me to Kenya Healthcare Federation, where she's a vice chair. And then that led to BOLT, that led to Rescue, that led to... So it became a string of different companies, Telesky, who could help in any way, in one way or another. So one came with, I can support the calls. Thanks. So that was taken care of. Another one came with, I can take patients. Thanks. That was taken care of. The other one was, we have ambulances. And everyone pulled their weight. They really pulled their weight to try and get the... and I remember going to Nairobi County, the NMS, and sitting down with the reproductive health chair and all these people and saying, this is the issue at hand, this is Nairobi County, these are the stats. And they gave us the blessing, and even started also sourcing to help. So it quickly became not just me, but so many people who were interested in helping Kenyan women and pregnant women. And then now we start getting calls from Samburu and Tharaka Nithi and places I had never heard of. So quickly looking for networks of, and I'm still looking for a network of like cab drivers around everywhere. So if you have any, please. Yeah, just looking for networks around there. And thankfully, we rode on the shoulders of giants, because a company like Bolt has its feet in 17 counties. So even if I didn't know where that was, I would call and I'm like, okay, I've been called from here, here, here. Now the problem is that we operate at night. We opened it up at some point to a 24-hour service, but then due to lack of funding, we went back to just at night. So it's 2 a.m. and I'm calling a Bolt guy. I'm like, I've been told there's someone in Chemelil's Jewel. I need a vehicle. So in the last 1 year, I have seen such a huge, tremendous impact. I thought that it would be an information platform. I really thought that it would just be to help women call and get kind of comfort in an understanding, because health centers, not so many were operational. Women themselves are scared to go to hospital. The hospitals didn't want so many people unless you are actually in active danger. So this served as a platform where you could call if you're pregnant and get information. But then it has evolved to you can call if you have any issue pregnancy related, especially when it comes to transport, when it comes to speaking to a doctor, understanding what your doctor told you. And that's the gap that we are filling. We have served over 10,300 women in 1 year, and that is remarkable. Beyond that, we have transported over 2,000 women to different hospitals. And the beauty is that we don't tell you have to go to this hospital. If you tell us we wanted to go to Chemilil dispensary, that's where we'll take you, because sometimes the nearest hospital is the best option. But if you've been going to your clinic in a private facility, a mission-based facility, a public facility, that's where we'll take you. And now, even with issues COVID, like if you call and tell us, I have COVID and I'm pregnant, then we know this is the kind of care that we're giving you. And this is the kind of transport we're allocating to you. And this is a facility that can cope with COVID in pregnancy. And therefore, we are also advising women, okay, you wanted to go to this facility, you're telling us you have COVID. For your best interest, we would advise that perhaps go to this facility because we have seen it can cope with COVID. Then we call your facility and we call the other facility and we see if there's room for you. So we're really trying to support the pregnant women. And my view for Wheels for Life is that no mother should face a pregnancy alone. And having been a patient myself and then now being a practitioner, I have had different views to this whole pregnancy thing to understand that it can be a very lonely journey. And sometimes you're saying, I have aches and pains here. And even your significant other doesn't understand what you're talking about, you know. So having someone at the end of the line at 3 a.m. to tell you, okay, it's okay. Rest, try do this. It's common. We've seen it with other women. It gives you peace of mind, you know. Then you calling at 4 a.m. and telling us, okay, these contractions, I feel like I'm in labor. We're like, okay, what are the timings? What are the intervals? What are these? What are those? And then, okay, you can go to hospital now or it can wait 2 hours. That also gives peace of mind to the pregnant women. And that's our hope. And then we really, really, really stand by. We don't want to lose a life while giving life, because who will take care of this new life, you know? So that's been the journey of Wheels for Life. We started as at a home with a tweet and my phone. It moved to a multi-level consortium with different people, and now it's moving to an organization that we run, so that there's continuity. Come 100 years, women still will need that kind of help, and we are here for it.